Welcome back to MedSEMA Nursing Podcast. Today, we're really tackling a cornerstone topic, fluid and electrolyte balance. It's absolutely vital for your NCLEX prep and honestly for understanding just about every patient scenario you'll come across.
It really is.
We'll break down how fluids and electrolytes are distributed, how they move around, and, the amazing ways the body keeps everything in check. Think of this as building your solid foundation for interpreting a huge range of clinical situations.
Exactly. And it's not just about memorizing definitions, is it? It's more about getting a real feel for these processes so you can anticipate what might happen with your patients and give the best care.
Absolutely. So, where should we start? Electrolytes themselves.
Yeah, let's start there.
Yeah.
Simply put, these are substances that when they dissolve in solution, like our body fluids, they split into electrically charged particles.
Ions.
Right, like sodium and chloride ions from salt and water.
Oh.
Okay, we measure fluids in liters, milliliters. But how do we quantify these electrolytes? Their activity?
Wow.
Good question. That's where Milliequivalents, or MEQ, come in. It's basically a measure of the electrolyte's chemical combining power.
Combining power.
Yeah. What's really neat is that 1 MEQ of a positive ion at a cation will always react perfectly with 1 MEQ of a negative ion, an anion. So it tells us about the capacity of these ions to jump into chemical reactions in the body.
Ah, okay. So it's less about just the number and more about what they can do chemically.
Precisely. And understanding AQ isn't just academic stuff.
Yeah.
It's crucial when you're looking at lab results. Like, how many milliequivalents of potassium does this patient actually need? It directly impacts your ability to, anticipate and respond to treatment.
That makes perfect sense. Functional capacity. Got it. Now, thinking about where all this stuff is located, it's not just sloshing around in one big pool, right?
Definitely not. It's compartmentalized. We have two major compartments.
Yes.
The intracellular fluid, which is actually inside our cells, that's the bulk of it, maybe 70% of total body fluid.
70% inside the cells. Wow.
Yeah. And then the rest, about 30%, is the extracellular fluid, everything outside the cells.
And that extracellular space isn't uniform either, is it?
No, you're right. Within that extracellular bit, we've got the interstitial fluid. That's the fluid filling the gaps between the cells. About 22% maybe.
Okay.
Then there's the intravascular fluid, basically the plasma in our blood vessels. That's around 6%.
Mm-hmm.
And finally, a smaller slice, maybe 2%, is transcellular fluid. That's specialized stuff like cerebrospinal fluid, synovial fluid in joints, the fluid in your eyes.
Gotcha. So these different compartments, they have their own unique electrolyte mix, right? Why is keeping that balance and keeping fluid in these compartments so critical?
Well, it's absolutely fundamental for normal cell function. Each space has a specific electrolyte environment, sort of tailored to what the cells need there. And there's this constant reciprocal dance of electrolytes across cell membrane.
Like trading partners.
Kind of. If sodium moves out, maybe potassium moves in, helping maintain that crucial electrical balance. For homeostasis, that stable internal state, the total positive charges and negative charges have to be equal in each compartment. And separating them are these semi-permeable membranes, very selective about what gets through.
I've heard that interstitial fluid, sometimes called the third space. What's the clinical meaning behind that?
Third spacing. Yeah, that describes when extracellular fluid gets trapped, essentially. It gets stuck in places it shouldn't be accumulating, usually because of disease or injury.
Like where?
Think about the space around the heart, the pericardial sac, or around the lungs, the pleural space. The peritoneal cavity in the abdomen, too, even just in soft tissues after a big trauma or burn.
Mm-hmm.
Imagine a patient with, say, severe sepsis. They might be third spacing a lot of fluid. Their weight might not change right away, but you might see their urine output drop even if you're giving IV fluids. Or they get puffy peripherally, but still look dehydrated systemically.
So the fluid's there, but it's unavailable, not doing its job in circulation.
Exactly. And a loss of effective circulating volume. And the tricky part is, it can be really sneaky. You might not see it immediately on the scales or the INO chart. Sometimes it only becomes obvious when organs start showing signs of stress.
Clinically very important to watch for then. Okay, and then there's edema. That's also fluid buildup. How's that different from third spacing?
Right. Edema is specifically excess fluid in the interstitial space, that space between the cells we mentioned.
Okay.
Unlike third spacing, where it's kind of sequestered away, edema is right there in the tissues. It can be localized, swelling around a sprained ankle, an insect bite, inflammation.
Yeah.
Or it can be generalized all over the body. We sometimes call that anasarca.
Yeah.
That usually points to bigger systemic problems, heart failure, maybe kidney failure, liver disease.
Okay, so third spacing is unavailable fluid. Edema is just too much fluid in the normal between cell space.
Got it. Now, thinking bigger picture,
Mm-hmm.
the body's overall composition. Water's the main player, right? Absolutely. Body fluids, all that intracellular and extracellular stuff together make up, well, roughly 60% of an adult's body weight. It's a bit lower in older adults, maybe 55%.
And higher in babies.
Much higher in infants, yeah, around 80%. And that difference is a big reason why infants and older adults are more vulnerable to fluid problems. They just have different proportions and maybe less reserve or regulatory capacity.
Makes sense. Less buffer. So besides water, what else is in these fluids?
Well, lots of dissolved substances. Some things, like glucose, urea, creatinine, they don't break apart into ions. But others do are electrolytes. Sodium chloride breaking into sodium and chloride ions is the classic example. And yeah, like we said, that delicate balance means you've got to monitor fluids really closely in infants and older adults.
Okay, so we have these fluids and substances in different compartments. How do they actually move between them?
There are a few key ways. One is diffusion. That's just the movement of the solute, the dissolved stuff from where it's more concentrated to where it's less concentrated.
Like dropping food coloring in water. It just spreads out.
Exactly like that. It happens across membranes that let the solute pass freely, or sometimes selectively, only letting certain things through. It occurs in compartments in between them.
Okay. Diffusion. What else?
Then there's osmosis. This is about the movement of the solvent, usually water in our bodies, across a selectively permeable membrane. Water moves from an area where there's a lower concentration of solutes to an area where there's a higher concentration of solutes. It's trying to dilute the more concentrated side, essentially. This movement is driven by what we call osmotic pressure.
Osmotic pressure. That's the force pulling the water.
That's it. It's the drawing power exerted by the solutes that can't easily cross the membrane. So basically, water follows the solutes to try and equalize the concentration on both sides.
So if you have more sodium on one side of a membrane, water will tend to flow to that side.
Precisely. Then there's filtration. This involves the movement of both water and solutes together, pushed by hydrostatic pressure.
Hydrostatic, like water pressure.
Essentially, yeah. The pressure exerted by the weight or force of the fluid itself. Things move from high pressure to low pressure.
I remember learning about hydrostatic and osmotic pressure working together, or maybe against each other, in capillaries.
You absolutely did. That's a perfect example. At the arterial end of a capillary, the blood pressure, the hydrostatic pressure pushing fluid out, is usually stronger than the osmotic pressure pulling fluid in. That pull comes mainly from proteins in the blood.
So fluid leaks out into the interstitial space.
Right. But then further down at the venous end, the hydrostatic pressure has dropped, but the osmotic pressure from those proteins is still there. So now the pull into the capillary is stronger, and fluid moves back in.
And the lymph system mops up any leftovers.
Exactly. The lymphatic system collects any excess fluid and solutes that didn't make it back into the capillary and returns them to the bloodstream. It's a really elegant balance. And you can see how if something disrupts it, like in heart failure where capillary hydrostatic pressure goes way up, you end up with fluid buildup in the tissue's edema.
That interplay is fascinating. Okay, you mentioned osmotic pressure, and earlier, osmolality. Can you clarify what osmolality measures?
Sure. Osmolality is basically a measure of how concentrated a solution is. Specifically, it's the number of osmotically active particles, the ones that pull water, per kilogram of water.
So, electrolytes, proteins?
Yep, things that don't easily cross membranes and therefore exert that pull. We measure it in milliosmoles per kilogram of water, Osm kg. And normal plasma osmolality is in the range of about 270 to 300 molam quasm curium. It's a really key indicator of the body's water balance.
Okay, so it tells us how concentrated our fluids are, which affects how water might move.
Exactly right. Cell membranes are selectively permeable, remember. Water moves pretty freely, but many solutes don't. So the concentration of those solutes inside versus outside the cell creates that pressure gradient for water. Think about someone with severe diarrhea. They might lose more electrolytes than water initially. This could make the fluid outside their cells less concentrated, lower osmolality than the fluid inside. What happens then?
Water would move into the cells to balance it out.
Right, which can cause cells to swell. It just highlights again how critical that balance of both fluids and electrolytes is for everything to work properly. Life depends on it.
We've covered diffusion, osmosis, filtration, mostly passive movement, right? Following gradients. What about moving things against the flow?
Good point. That needs active transport. This is when the cell has to move ions or molecules across its membrane from an area of lower concentration to higher concentration or against other pressure gradients.
Going uphill.
Exactly. And like climbing a hill, it requires energy. The cell has to expend energy, usually using ATP, to make it happen.
What kinds of things move this way?
Lots of important stuff. Key electrolytes like sodium, potassium, calcium, also iron, hydrogen ions, even some sugars and amino acids need active transport to get where they need to go against their concentration gradients.
Okay, so active transport uses energy for that uphill push. Now, shifting gears a bit, where does all our body fluid actually come from? Intake.
Right. Intake is mainly three things. The liquids we drink, obviously. Then there's water contained in the food we eat. And finally, a smaller amount called metabolic water, which is actually produced by our body during metabolism.
Metabolic water. Interesting.
What are the rough amounts?
Typically, an adult might take in, say, 1,200 to 1,500 milliliters from liquids, maybe 800 to 1,100 milliliters from food, and around 300 milliliters from metabolism per day. Give or take, of course.
Okay. And how do we get rid of fluid output?
The kidneys are the superstars here. They excrete the largest amount as urine, and they're incredibly smart about adjusting the volume and how concentrated that urine is based on what the body needs, how much you drank, waste products, overall balance.
Kidneys are key. What else?
We also have what's called insensible loss. Fluid we lose without even realizing it.
Like,
Through the skin, just general perspiration, even when you don't feel sweaty. That's maybe 100 milliliters a day on average, but temperature affects it. And through the lungs, the water vapor in the air we breathe out. How much depends on how fast and deep you're breathing.
right, insensible. And the GI tract. Yeah, the GI tract handles huge volumes of fluid secretions for digestion and so on. But normally most of that gets reabsorbed further down. The net loss in stool is usually small. But if someone has severe diarrhea, that reabsorption fails, and they can lose massive amounts of fluid and electrolytes very quickly.
So normally, intake and output should roughly match.
Yeah, as long as all the organs are working properly, the body keeps things in balance remarkably well. But like we just said, things like severe diarrhea or vomiting can throw that balance way off, putting people at high risk.
Okay, so bringing it all together, how does the body maintain this incredibly complex balance day to day?
It all comes back to homeostasis, maintaining that stable internal environment. The body constantly monitors the concentration and composition of its fluids. If there's a deficit, it triggers thirst, or clinical interventions like IV fluids replace what's missing. If there's an excess, the body works to eliminate it.
And specific organs lead the charge.
Absolutely. The kidneys, as we've stressed, play the starring role in controlling both fluid volume and electrolyte levels. But they get signals. The adrenal glands produce aldosterone.
Aldosterone, that affects sodium.
Exactly. Aldosterone tells the kidneys to reabsorb more sodium, and water tends to follow sodium, so that helps regulate extracellular fluid volume. Then there's the pituitary gland, which releases antidiuretic hormone, ADH.
Antidiuretic, so less urine.
Right. ADH tells the kidneys to reabsorb more water specifically. This helps regulate the osmotic pressure, the concentration of our extracellular fluid. It's this beautiful interplay between organs and hormones.
It really is intricate. Okay, let me try and quickly summarize the key points we've hit. We started with electrolytes, defining them and how we measure their activity using Milliequivalents on EQ. Then we mapped out the body's fluid compartments. Most fluid is intracellular, the rest extracellular, which includes interstitial, intravascular, and transcellular fluids. We talked about why keeping these separate but balanced is vital, and touched on problems like third spacing trapped, unavailable fluid, and edema, which is excess fluid in the interstitial space.
Good.
We then looked at how things move. Passive processes like diffusion, solutes down a gradient, osmosis, water following solutes across membranes driven by osmotic pressure, and filtration, fluid and solutes pushed by hydrostatic pressure, especially in capillaries. We also defined osmolality as the concentration measure,
Right.
and contrasted passive movement with active transport, which needs energy to move substances against their gradients. We briefly mentioned solution types based on osmolality, isotonic, hypotonic, hypertonic, and how they affect cells.
Yep.
Then we covered fluid intake, liquids, food, metabolic water, and output, kidneys as the main regulator, plus insensible losses via skin, lungs, and GI tract losses, which can be huge in diarrhea. And finally, we tied it together with homeostasis, emphasizing the roles of the kidneys and hormones like aldosterone from the adrenals and ADH from the pituitary in orchestrating this whole fluid and electrolyte balance.
That's an excellent recap. Honestly, getting a solid grip on these fundamental concepts, compartments, movement, regulation is just indispensable. For the NCLEX, yes, but really for everyday nursing practice, this knowledge underpins so much of what you'll see and do.
Absolutely. Understanding these principles will serve you so well across countless clinical scenarios. We really encourage you to keep reviewing these concepts as you continue your NCLEX preparation. Well, that wraps up our deep dive into fluid and electrolyte balance for today. We hope this has helped clarify these really crucial physiological processes for you. Join us next time on MedSumo Nursing Podcast for another in-depth exploration of essential nursing topics.